Hello, we would like to thank you for your interest in our poster today concerning vital signs measurements as practiced by physical therapist students in outpatient clinical experiences. We became interested in this research because for excellent quality of care, physical therapists must monitor vital signs as an essential aspect of a physical therapist examination to determine patient referral to a medical practitioner and to assist with clinical decision-making for patient tolerance and progression. However, evidence indicates that vital sign measurements are infrequently practiced by physical therapists employed in outpatient settings. Thus, the purposes of this study is 1, analyze the frequency in which vital signs are measured by doctor of physical therapy students during full-time outpatient clinical experiences, and 2, analyze the differences in frequencies of vital sign measurements taken among outpatient settings in areas of practice by the doctor of physical therapy student. 39 Texas State University doctor of physical therapy students were invited to participate in the study with inclusion criteria being completed forms submitted during the full-time clinical experiences between June 2021 and December 2021. A Microsoft Excel spreadsheet was provided for participant documentation of the number of patients seen daily and which vital signs, heart rate, blood pressure, and respiratory rate or oxygen saturation rates were measured for each patient. Frequencies and percentages of vital signs taken were calculated and differences between areas of practice were determined using a chi-square test of independence. 18 of the 40 forms submitted met inclusion criteria and were included in the data analysis. The areas of practice were orthopedic musculoskeletal, sports, pediatrics, and cardiovascular and pulmonary, with 72% from the orthopedic practice. The types of outpatient settings were private practice, hospital outpatient, and other. Of the 7,815 patient visits recorded, no vital signs were recorded in 92% of the visits. Heart rate was the most frequently measured vital signs, and no respiratory rates were measured. This information may be found per setting in Table 1. A chi-square test of independence found a significant difference between vital signs taken in different practice areas. Post hoc analysis using standardized residuals identified there were fewer than expected vital signs measured in all areas of practice. These results indicate that vital signs were measured by doctor of physical therapy student only approximately 8% of the time across practice settings and areas of practice during these clinical educational experiences in outpatient settings. The lowest of vital sign frequencies were in the sports and pediatric settings. Students in foundational entry-level doctor of physical therapy programs are exposed to the importance of measuring and monitoring vital signs throughout the program, as this is an accreditation criterion. Since the vital signs were not taken during the majority of the clinical education experiences, we assume that the clinical instructors were probably not taking vital signs as well. Thus, even though students had been educated about the importance of measuring vital signs and how and when to measure them, the influence of the clinical instructors superseded the academic instruction. Additionally, the Physical Therapist Manual for the Assessment of Clinical Skills, we all know as the PT Max, consists of over 28 skills considered essential to the safe and effective practice of physical therapy. 2 of these skills and objectives include the measurement of vital signs. Thus, this data supports that even though vital signs measurements is essential for physical therapist examination and plan of care in the outpatient setting, vital signs were documented less than 10% of the time. These findings are inconsistent with practice expectation and the student's education. The limitations for this study include the small sample size, and the forms were from one class of a single doctor of physical therapy program. It is suggested that future study include more than one doctor of physical therapy program with a larger sample size. Thank you for having an interest in our poster today on vital signs measurement as practiced by physical therapist students in outpatient clinical experiences.